After an hours-long planning commission meeting, a parking ramp renovation at Spectrum's Blodgett Hospital campus is still on the table. Spectrum coming with revised plans and neighbors responding with their own suggestions of what should be done. 24-Hour News 8's Sarah Hurwitz was at that meeting. She's live in East Grand Rapids with a recap.
Well, good evening, Marley. Neighbors coming to play tonight with fully prepared blueprints of how they feel the plan should be revised. This after Spectrum presented its revisions to the board tonight, which ultimately is tabling the decision and not making any decisions for the next 3 weeks.
Previous height shown in gray is 38 feet. The new ramp is 22 foot at that location, therefore 16 foot lower.
Spectrum Health coming with major revisions to its original proposal to add 2 new parking ramps on each end of Blodgett Hospital. This has been an ongoing discussion now for months, with neighbors raising concerns over the height of the ramps and whether they'd be looking at a cement wall out their front door, construction noise, as well as what it could mean for property values and city revenue. But Spectrum working to make changes and take those concerns into consideration.
And we've also added this element here of a 4-foot high retaining wall. One of the reasons we're doing that is to help provide some additional breakup to the even lower 22-foot height.
Major revisions included reduction in height and size of the south ramp, lowering the ramp by 1 level from 5 to 4 stories, and moving the setback to 7 feet to reduce the height on Plymouth. Also adding a stone fence and additional landscaping to help block the view. Despite a recommendation from a consultant to approve the proposal with revisions tonight, neighbors coming prepared and having their own response to the plan with a thorough presentation.
They currently have 2 units that they're using, probably running 24/7, but we're not seeing an increase in utilization.
David Brown and several other neighbors presented tonight questioning Spectrum's proposal based on data that he found on hospital usage and how much it would hurt the city's revenue, presenting their own plan with their own architect out of Lansing, asking for Spectrum to consider theirs instead.
And we appreciate the fact that they've listened to us, they've taken time, they've taken our input, they've made some changes, and their words are significant and ours, they're marginal.
And again, the Planning Commission ultimately tabled making any decisions tonight. It will take up this issue again at its next meeting on April 10th. Now, it has 3 decisions that it can make. It will likely have a vote on that evening. It can either recommend it to the City Commission, it can recommend the proposal with provisions, or it can deny the proposal. Live here in East Grand Rapids tonight, Sarah Hurwitz, 24-Hour News 8.